Hello, everyone. I'm Jessie Myers-Schechter from Prostatepedia. Today, I'm talking with Dr. Rob Newton of Edith Cowan University in Perth, Australia, about exercise for prostate cancer patients during the COVID-19 pandemic. Welcome, Dr. Newton.
Hi, Jessie. Great to chat with you today.
Great. Can you talk to us a bit about the work that you were doing with prostate cancer patients before COVID-19?
Oh, certainly. We've been researching exercise as a medicine predominantly in prostate cancer for the last 16 years and run a whole series of trials, about 30 trials in all, in different stages of disease, from early stage men on active surveillance right through to our current international trial, which is in men with advanced metastatic disease. And it's a trial. We're actually in a randomized control trial, so a very highly controlled trial to see if exercise can actually extend survival. So we have a very large range of research trials ongoing and in various cancers, but in particular in prostate cancer.
And why is it so important for patients with prostate cancer to exercise while they're sheltering in place during the COVID-19 pandemic?
Certainly. Well, certainly the COVID-19 situations created a lot of problems in particular, well, for everyone, but for cancer patients, it's particularly concerning because clearly they're at much higher risk. There's been some early data that's come out of China, some published papers in good journals. And what the Chinese have reported is that the incidence of COVID-19 is higher in cancer patients, and the incidence of more critical conditions also is much higher. This is understandable because patients who have prostate cancer are generally older, for example, and that's a greater risk factor, but also they have all these other comorbid conditions as well. They have the cancer itself and then a lot of the issues around the treatment. Many of them will be immunosuppressed, and so they're more likely to contract the disease, but also they're more likely to have worse conditions and symptoms. So this is a challenge because certainly most countries of the world now, certainly exercise clinics have been closed, fitness centres, many parks, and the general recommendation certainly in Australia, not the recommendation, the requirement is that you do not leave your house. And so, we have millions of people in Australia which are confined to their house. And this creates a challenge because it's absolutely critical that everyone continues to exercise every day, even just a short amount. And the reasons for that is that you don't want other chronic diseases to develop. So if you're sedentary at home, you're not exercising now because of COVID lockdown, then you're more likely to progress cardiovascular disease, diabetes, etc. The other aspect to it is that if you are sedentary, then you're at your immune capability is reduced. Exercise is very important to keep your immune system at its peak, to keep it trained, if you like.
Right.
And so it's important to exercise each day because it will lower your risk of catching the disease. And absolutely, if you do contract COVID-19, if you remain physically fit and physically active, then you're very likely to have less severe effects of the disease, and certainly it may even reduce your risk of having to go to intensive care. So very, very important, absolutely critical that we keep exercising. Interestingly, in Australia, there's only 4 excuses as to why you can leave your house: to seek medical care, any emergency, obviously, and to get food. The 4th one is to exercise. And so that's how important the Australian government places on the fact of keeping people physically active and exercising. It's one of the only 4 reasons as to why you can leave the house in the current shutdown. For cancer patients, of course, it's probably even more important that they do exercise each day in their home. And that's because with prostate cancer, for example, is, if you're on any treatments, particularly androgen deprivation therapy, then you have all the side effects of that treatment, such as muscle loss, fat gain, bone loss, increased cardiovascular risk. And so it's important to keep exercising. The other aspect to it is very much the mental health side of things. So, we're under an enormous amount of strain. It's an extremely difficult time. And we know from a large amount of evidence over decades that exercise is very, very effective in helping us cope with really stressful situations. So, if we exercise, then we'll have less severe anxiety. It can help to reduce depression. And they're going to be major problems over the next several months, is, coping with the new environment. Particularly, I think, for older people, there's a lot of fear. They know that they're at higher risk of catching the disease. They know they're at higher risk of actually dying of the disease. And, they're locked down at home, often they're alone.
Right.
And, this creates enormous problems in mental health as well as physical health. So, exercise is a fantastic way in which that, you can help to overcome that and help to reduce all of those other risk factors that might really be impacting now.
Right, for sure. So how has the way that you're working with patients changed? Are you using telemedicine? And if so, what does that look like for you and your patients?
Certainly. So we've had to adapt markedly. So we had to close our exercise clinics 3 weeks ago. And so our patients were no longer able to come in to receive their exercise medicine dosage. And that was highly upsetting for them, highly upsetting for us as well. But, it's just necessitated. We can't take the risk of having groups of older people with cancer in a public environment. I mean, the exercise clinics, obviously, we take all caution and with, hygiene and sterilisation and, physical distancing, but the risk is too high. And so we closed, and the government requirement is in Australia, you have to stay at home. So what we did is we quickly transitioned them all to telemedicine, as you say. So we're now delivering our exercise programs into their home, and we're using a wide variety of tools to do that. The Australian government was very responsive to this. Normally our Medicare system actually pays for exercise prescription and assessment. And so a patient who has cancer, for example, can go and see an exercise physiologist, and they will get assessed, they'll get an exercise prescription, and then they'll be monitored in that exercise. And that's all paid for by our public medical system. The Australian government was very proactive. They actually changed our legislation around Medicare such that exercise physiologists could actually provide those services through telehealth. And so we can now provide these consultations to the patient over the internet or telephone, and they don't have to pay because the taxpayer pays, our medical system. So that was an important change in legislation, which our government pushed through in a matter of days. And so I'll just take you through some of how that's actually adapted and what we've done to actually achieve that. And I'll just share my screen now.
Okay.
Okay, so the first part, so Jessie, I'll just check that you can see the My Wellness screen at the moment. Okay. So this is the platform that we use to prescribe our exercise program. So this is a product from Technogym. So Technogym is one of the largest health and fitness equipment and software companies in the world, and unfortunately based out of Italy. And they're obviously devastated at the moment and doing it really, really tough. So my heart really goes out to my Italian colleagues. Yes, but with this system, what it allows us to do is to I'm sorry if you're going to see some names here, so we'll just go very quickly here. But for a given patient, and we'll choose one, we'll choose a mock one here. This is actually my daughter. So I've made up one for her so that we weren't actually using a real patient. And so the patient details are here. And what we can then do is assign an exercise prescription to that patient. And this is a workout which has been assigned. We're doing a lot with assigning workouts that don't require any equipment. We have set up a library, if you like, where we actually loan exercise equipment out. So dumbbells, stretch bands, even little plastic steps, so that the patient can exercise at home. But we also provide programs that don't require any equipment at all. there's also a lot of other ways in which you can exercise with just household items. Large cans of dog food, for example, or bags of rice. Although I must admit, in Australia at the moment, it's very difficult to buy rice.
Yes.
But another really nice example, which we've been doing, is using backpacks. So I don't know why it is. It's human nature. We seem to accumulate a lot of those little backpacks. We get them at various things that we go to, and our kids seem to have lots of them. And if your kids have left home, then you'll no doubt have a whole bunch of backpacks stored somewhere in the attic or the basement. But they're very good because they've got handles on them. They're very, very strong. And what we've been doing with our patients is they've been filling garbage bags with sand and double bagging them and then putting them in the backpacks. And so you can, if you want to make it heavier, you just put more sand in, make it lighter. But we can prescribe a really high quality resistance training program just using a backpack, these weighted backpacks, and that's been working very well as well. So we've got a very basic program here with a warm up and then some whole body resistance training exercises here that the patient can do. So what we do then is, once we've designed that up, and this is just a very basic example to show you, but what we're doing is, depending on the patient's requirements or what issues are impacting them most, we're providing a tailored exercise prescription for them. So we do tailor it so that, if they, for example, have a bone metastatic cancer lesion, for example, in their right upper arm, in their humerus, then what we'll do is we have to adjust the program so that we don't overstress that particular body part. So the programs are tailored. And then once we assign that to the patient, then they can then access that program through the web. So this is the web interface, or web browser interface that they see. So once they've logged in here, this keeps track of all of their activities. So you can see for each day what activities have been done here. It keeps a track of that. They can dig down into a particular day and they can see, what they actually performed there. And this is great feedback, and it allows us to track on each day what they're doing, whether they're doing their exercise. If they're not, then that's a trigger for us to give them a call and say, look, you're going okay, is there any problems? Because again, I reiterate that, these people are often at home. They may not have, the family can't come to see them at the moment. Right. So it's just maintaining that contact to make sure that we keep them exercising, but also as a wellness check to see how they're going each day. And then that's tracking their exercise each day, but they can also view their program. So that's that no equipment basic program that I showed you previously. And then we click on view, and the patient gets their program displayed here with information about it, how to go about the actual exercise. So if we choose an exercise here, they start at the beginning. It's 8 exercises, 22 minutes. They start with the warm up, and then they go into the next exercise. This is a squat. I don't know if you can see this on screen, but it actually presents a video for them. So if they're a bit stuck as to, well, how do you actually do this exercise, then they can view a video there. They do the first set for 30 seconds, and then they rest for 30 seconds here as well. Mm-hmm. And if necessary, they can change the time. So if they use a different weight or a different number of repetitions, they can put that in there and it records it for them. So that's how we're pushing the exercise prescription out. The other way we're doing it is, I'll just share my smartphone. So I have an iPhone, but it works just as well on an Android phone or an iPad. So if you can see there, that should be showing you screen mirroring. So all of your smart devices will have this capability where you can actually display the screen on your phone or your iPad, your tablet. You can actually display it on your computer screen. Or what we do is we set them up so they can show their screen on their television. So instead of trying to do their exercise peering at a phone, they can show it up on the big screen. The sound can come through, so they can listen to music, or as I'll show you in a moment, they can actually use the video chat at the same time. So I'll just show you how that works in terms of the screen. So this is my screen here. And what I'll do is I'll go to My Wellness. And so this is My Wellness actually running on my iPhone. And so this is the other way they can access it here. And again, you can go to your program here. It's the same workout as you can see here. Click on Start, and away you go. And it takes them through their warm-up there, which is just a 5-minute walking warm-up. And we have our patients, you know, walking up and down their hallway, walking on the spot. You don't need a lot of room. We have a lot of patients which are in retirement homes, so their little house is very, very small. So we just have them marching up and down on the spot, skipping perhaps if they've got a skipping rope, or they can mimic skipping. Again, on the iPhone, it's not a promotion for Apple, on their iPhone or their Android phone, they can see the exercise. It will actually time them as well. So you can see there, once they hit start, it actually counts them down and times them through the actual movement. So it times their work periods and their rest periods. So that's with the resistance training. What we're doing with the actual aerobic side of things is we're using a lot of high intensity intermittent training, HIIT training. And so this is where we have phases of work, then active recovery. So we might have them stepping up and down on a box or a small table, and they'll do that for say 40 seconds, and then they'll recover for 20 seconds. And they might do 6 rounds of that. And we're finding that very, very effective for keeping their cardiorespiratory fitness up as well.
Do you anticipate that once all the shelter in place is over and life resumes to normal, so to speak, that you'll be incorporating more of these sort of telehealth tools into your daily practice with patients? Or do you think that the tools will become no longer needed?
Look, Jesse, I think everyone recognises the world's changed forever. And absolutely, I think what we're seeing is that we've been a little bit slow, I think, in really shifting a lot of these practices to telemedicine, which is a shame. One of the greatest issues we face in cancer management and provision of service is that there's a huge disparity between people's outcomes when they live in a metro area versus, a regional, rural, or even a remote area. So, if you're living in San Francisco, you've got great access to medical care, allied health, and everything else. But if you're, out in North Dakota somewhere, it's very, very difficult, and that's shown in the survival statistics. It's much lower just because of that disparity. So I think this has pushed us to really develop some really cool techniques in which we can try and equalise that disparity between people that live in urban areas versus those that live rural and remote, which is a good outcome. I think also that a lot of uptake of exercise medicine has been limited because the difficulty of patients actually getting to an exercise clinic, and that's a problem. We see it all the time. We say, the patient says, "Well, I know I've got to do this, but it's an hour on public transport to get to your clinic." And with everything else, I've just been diagnosed with prostate cancer. I'm still working or trying to. I've got a family. I'm going for radiation therapy. It's just too much. It's difficult to fit it in. But with these technologies, we can deliver a high quality exercise program directly into their home, which they can do at any time. If they want to do it at 5 o'clock in the morning, that's fine. If they want to do it at 12 o'clock at night. So I think I'm very confident that these services and these technologies will continue well beyond COVID-19, and they'll just enhance the service and support that we can provide to patients.
Right. Just a question. Right now, you're obviously working with people in your local community and then using these telemedicine or telemedicine tools with them. But now that you're relying more on these kinds of tools, is there any reason why you can't work with, say, an American patient here who doesn't have access to a professional like yourself?
Oh, absolutely. We have been providing these services internationally for some time now, but not at the same fidelity. We have been using through our My Exercise Medicine platform. So we have been delivering exercise assessment and prescription to people in the UK, Europe, interestingly, a lot of support in China, because exercise medicine is not well established in China. And China, Thailand, Indonesia, Malaysia, it's just not developed. They don't have the professionals trained in this area, and they don't have the facilities. And so, I think people right throughout the world are now reading, and the clinicians are now reading, the importance of exercise and medicine to support cancer patients. And now they're saying, well, how do I get it? And so we get a lot of inquiries, and at the moment we're managing many dozens of patients around the world, where we're, exactly as I showed you, we assess them. We can push out a whole range of assessments electronically. So we push online forms and questionnaires out to the patients, where we assess their current health and medical condition. For prostate cancer, for example, we push out prostate cancer specific questionnaires to try and get an understanding of their patient-reported outcomes, what's most impacting them. We then use this system here, the Technogym My Wellness, to design them up a tailored exercise program, and then we push that out to them so they can get that on their smart device or on their computer.
Right.
The other aspect that we use extensively is web video conferencing. So you and I are talking today on Zoom, which is a fantastic video conferencing platform. There's many others, including your social media platforms such as I can't think of any of them at the moment.
I know Facebook Messenger actually has a video chat.
Messenger, good example. That's how I chat with my daughter. And we use Messenger to chat back and forth. There's a whole range. Viber, Skype is another one. In the health setting, though, we have to be very conscious of confidentiality. And so we actually use Microsoft Teams because Microsoft Teams, and again, I'm not pushing any product. All I'm doing is explaining what we do. And people really need to research and have a look what best suits for them. Again, there's many other exercise prescription platforms besides Technogym My Wellness. We've settled on that one for a number of reasons. It's HIPAA compliant, so it complies with the American standard in terms of confidentiality and protecting information for patients. It is compatible with that, so that's a reason. It's also, we've gone with Microsoft Teams because it's HIPAA compatible as well. Now, the American standards around this are the highest in the world. The Australian standards we have, but because the American standards exceed the Australian standards, we've gone with those products to be HIPAA compliant. Right. So if there's any medical health professionals out there, I really encourage you to ensure that whatever tools you choose, they are HIPAA compliant. So what we're using in terms of the video conferencing, we use Microsoft Teams for this. Again, it comes as part of Microsoft Office if you get the business edition. Again, I'm not promoting, I don't get a kickback from Microsoft, I'm just telling you what we use. But again, it allows us to reach out to the patient. We send them an invite, we can book that in. It turns up as a calendar event in their Outlook or Google Calendar, whatever they use. And then it keeps the reminders for them. They click on it. They can join us on a web browser, or they can download the app. And again, they can video conference with us, just like you and I are video conferencing now. And also it works on their smart device as well. So we can video conference with them using their smartphone or their tablet computer. And so what we're doing then is we're running them side by side. So we'll have them load up the actual My Wellness, And then what we'll do is, just like we're doing here, is just kind of check, is it displaying you and me on the video as well at the moment?
Yeah, they can see us.
They can see us? Okay. So that's what we do. So you've got the exercise physiologist here. You've got the patient. So I'll be the exercise physiologist. You're the patient. And I can see you. I can talk to you. The patient can see the exercises that are being displayed. If you stand back a little bit, I can watch you do the exercise. I can check your technique to make sure that you're doing it correctly, and answer any questions. So that's where we're at the moment, which is highly motivating. And look, our patients are reporting that they're just so excited about when we have our exercise session, because again, they're in lockdown, very little contact. Some of them are very lonely. They're very scared. And so, this 3 times a week, we catch up with them in this format, take them through their exercise program, and it's really helping. What it lacks, though, is the group exercise environment. And in our clinics, we encourage this to get them exercising with other people, their own age or their own, facing their own issues. So, guys with prostate cancer, they'll exercise with a whole bunch of other guys that they come into the clinic. They book in and exercise at the same time, and they'll go and have a cup of coffee after it. And that's very, very important to keep them motivated and keep them engaged. That peer support is so much stronger than me as an exercise physiologist talking to them and saying, "Oh, you really need to do this." So what we've done is we've set up video chat groups through Teams, whereby they can do group exercise classes. So although you can see you and me in these group exercise classes, we might have 6, 8, 10 men all exercising together. They can see each other here. They can talk to each other whilst they go through the exercise program. And we're finding that particularly engaging and very motivating for the patients.
Right, because they get to see not only you, but each other, and then they're kind of working out together, right?
They're working out together in a virtual environment, and that's what we need to achieve. All the studies and our own clinical experience is very hard to get a patient to work out by themselves at home. I can't do it. I find it very unmotivating. And by creating these peer support where they're doing group exercise with guys they know, they've been exercising with them for maybe 3 months, they might have been exercising with them 3 years. And as of COVID-19, it's finished, it's done. Right. And that's creating huge psychological issues for them. And being able to catch up with their mates, we call them mates in Australia, what would you call them, buddies in the US, being able to catch up with their buddies, exercise together, have the exercise physiologist present in the session, just to check, to make sure everything's going okay. I'd probably just like to move on and just talk about the use of wearable technology and smart devices where with Technogym My Wellness, you can actually link it to your smart device. And I haven't got my watch on today, but I have an Apple Watch, for example. And most of these systems will actually draw the data up that is collected on your wearable technology, your physical activity monitor. And it will also feed that back to you. And so we're looking at ways in which we can monitor that to make sure that the patient's working at the right level, not too high, not too low. And there's the Apple Watch, Fitbit is another good example we're using extensively, Garmin. There's so many products on the market now, and some of them are relatively inexpensive, under the $100 mark, to get an activity monitor. And again, we're moving towards the use of this to display in real time, and so we're working on that sort of technology as well.
Right. Well, I suppose the more information you can gather from the exercise session, the better. The more you can tailor it to their own particular needs, correct?
Oh, absolutely. And I think that patient monitoring is a very important aspect. What we see is that when they start to make changes in their physical activity patterns, they might be reducing their amount of physical activity or reducing the intensity of their physical activity. We're seeing more sitting time. That's a bit of a trigger to say, well, hang on, is something going wrong? Are they getting depressed? Is their disease progressing, or are the treatment side effects, the toxicities of treatment starting to accumulate? And so being able to monitor that and look for patterns of change, I think, in their physical activity, that's extremely important for monitoring people with cancer.
Right. So do you have any recommendations for men who are listening to this, who maybe don't have access to this kind of program, who are isolated at home, and maybe have an exercise program, maybe don't? What should they do?
Sure. Look, I think the main thing is to avoid physical inactivity. The most important thing is to get moving. A little bit is better than none. More is better than less in the main. Look, there's an enormous number of tools that people can access. On our website here, for example, we've got a whole range of patient support here, including some examples of exercise prescriptions that we've generated. So these are sort of boilerplate exercise prescriptions here, home-based. We put up 3 different levels here. So if we go to level 2 here, this is a basic exercise program, can be done at home. The only thing it really requires is some form of step and perhaps an elastic band, but that's not necessary. There's other ways to do those exercises. This particular one includes a resistance training workout, which lasts for 20 minutes. And then it also includes a circuit here, which is 6 exercises, 3 rounds here, 17 minutes. So this is a high intensity intermittent training program for 17 minutes, but gives you a fantastic cardiorespiratory benefit there. So we're putting a lot of these resources out that are free to download, that people can access on our website and use those. Beyond that, though, there's just an enormous number of resources on the internet, and the majority of them are free or very, very inexpensive. Mm-hmm. And so people can access those as well. What we use a lot, I think, is the various tools that are available. We use, as I say, high intensity intermittent interval training, such as programs like I just showed you here, where you're doing these exercises with a certain period of high intensity exercise and then active recovery. So in this example, you're doing sets of 6 repetitions with 10-second rests in between. And there's a whole range of tools that are available. You can get special tools on your iPhone. It's not an iPhone, it's any smart device, any smartphone. If you look up Tabata, T-A-B-A-T-A, Tabata, and then there's a whole range of free apps that you can download. And they allow you to do this high intensity intermittent or interval training, and also high intensity resistance training, where you can program in the periods of work and the periods of active recovery as well. So we've got a whole lot of resources again on our website on how to do that. We've also got resources on here around hardware as to how you connect. For example, how do you actually connect your smart device so it shows on your television? That's called casting, and we walk people through that. Some other tips there around how you can use your existing hardware just to make this a little bit easier during the time of COVID-19.
Great. Now, if someone is listening to this and would like to participate in your program, can they contact you directly through email or phone to find out about that? Or is there someone else in your organization that they should be?
No, absolutely. So they can contact me directly. They can contact us through email here. So it's info@myexercisemedicine.net. So this is the obviously the anti-spam, which we have to do now. It's crazy. You can't actually put an email address on a website because otherwise you get bombarded with rubbish. But they can contact us there. They can go straight to our website, which is myexercisemedicine.net, and through there they can access all of these resources. If they just go to patients here, then they can access the exercise prescription and all the other patient resources that we have on available online for free through that site. If they also want to get more detailed support, then we do, as I mentioned earlier, they go to the homepage, services for patients. Then it explains how we actually can offer health assessment pre-exercise screening, and then tailor an exercise prescription directly for them. And then we can sign them up to My Wellness, and they can receive their exercise prescription on their smart device or computer. And yeah, so we can help them regardless of where they are in the world.
Okay, great. Any last comments or advice for men who at home now during the pandemic?
Just you have to keep moving, keep exercising. I know it's hard. This is very depressing. You know, I think all of us are finding this extremely difficult. It's very, very scary. We don't know when it's going to end. And so life is very uncertain. Plan your day out. You have to stick to a schedule. So what I suggest is you schedule your exercise session in at a time that suits you and works for you. Get dressed in your workout gear. Make it a ritual where you prepare for it. Find a place in your home which is your exercise space. Don't put it away and then get it out, because that's a demotivator. Make a space, set it up, and leave it set up. So every time you walk past, you go, oh, okay, that's right, I've got exercise today. As I say, where possible, try and hook up with a buddy. So try and use Zoom, Microsoft Teams, or Messenger or whatever to reach out to your friends, your family, and set up make a time for a call. I mean, a lot of people at the moment are doing drinks in the afternoon, for example, where they'll use social media, hook up with friends and family, have a nice glass of wine and chat like they normally would, but they can't physically be together. And that's very, very important. So do the same. Make a time to catch up with your buddies or your family. Do your exercise session, have a good chat and motivate each other. But you have to keep moving. If you don't, your treatment side effects will only be worse. Your quality of life will be declining. Anxiety, depression will be worse, and ultimately, your chances of surviving this will be lowered. We have to keep our immune system up, and at the moment, the best way to do that is through regular physical activity.
Right. Good advice for all of us, not just men with prostate cancer, right?
Absolutely.
Okay. Well, thank you very much for joining us today, Dr. Newton. Have a wonderful evening.
Thanks, Jesse. Thanks for the opportunity, and yeah, keep well, everyone. Look after yourself and your friends and family. Thank you.
Stay strong.
Stay strong.